And back here in the U.S., health officials say a potentially deadly superbug infected several patients and more than 160 were exposed. At least 2 patients died at the Ronald Reagan UCLA Medical Center in Los Angeles, California. Officials believe the superbug, which is resistant to antibiotics, was likely transmitted by contaminated medical instruments. Dr. Amesh Adlja is an infectious disease physician at the University of Pittsburgh Medical Center, and he's joining us from there. It's good to see you, Dr. Adlja. Thanks so much for being here with us.
Thanks for having me.
So let's just cover the basics. This bug is called CRE. You can say the big old name if you want to, but tell us what this is, what this pathogen is.
Well, this pathogen is a antibiotic-resistant bacteria. So it's a whole class of bacteria that are resistant to one of our last-line defenses against bacteria, and that's called the carbapenem. That's what the C stands for in the CRE name. And what we've seen is an alarming increase in these infections, so much so that the CDC has labeled it an urgent threat. And it really, really threatens, the viability of modern medicine if this march of antibiotic resistance continues. And CRE is one of the leading candidates to really disrupt the entire edifice of how we treat infectious diseases now.
Amesh, is there any antibiotic that's effective against it?
Sometimes you can find other antibiotics. For example, there's an old antibiotic called colistin that sometimes we can use, and there are some more toxic antibiotics called the aminoglycosides that may have some effect. But really, all of our good options are have run out with CRE. There's not really much you have left to treat with. So your toolbox is very thin against this pathogen.
Yeah. Well, compare this pathogen to the one that most people are very familiar with, and that's MRSA.
This is not quite as common as MRSA or MRSA. MRSA is really widespread, and it's in the community, and about half of all skin infections in the community have MRSA present. And we do have a pretty vibrant pipeline of drugs against MRSA. I don't usually, in my own practice, run out of options if I have a MRSA infection. I can usually treat it. They are deadly, and they can be deadly, and they are dangerous, but it's a whole new level of threat when you're talking about CRE, because these are people that get infected that are very sick to begin with, and then you don't really have anything left. With MRSA, we've got a few things. With CRE, really, it's kind of touch and go what you actually have to treat it with.
Yeah, it really does raise concerns. And of course, we're talking about this because there was an outbreak at the medical center at UCLA connected to a specific type of endoscope. Is there something about this endoscope that makes it difficult to clean? What's the connection there?
Well, endoscopes are invasively put into someone's into their intestine, and the particular endoscope that they're using here is called a duodenoscope, which is very technically advanced and has a lot of joints and crevices, which make it much harder to clean. So however great it is technically, it makes it that much harder to clean. So we have to emphasize that people will use the endoscope appropriately.
And so what should be done? What do you think the recommendation will be? Because it's my understanding that these instruments were clean. This was not a matter of neglect. It was just a matter of, in spite of the cleaning, that the endoscope still harbored this bacteria. So should there be a re-examination of using this instrument, or how the instrument is used?
Well, we have to make sure that people are following the manufacturer's recommendations to clean it and making sure that that's followed meticulously. We found out in the Ebola outbreak, for example, that we know that hospitals don't always adhere to all their infection control procedures to the T. And with pathogens like CRE, you really have to be careful, because especially with an endoscope, because you're putting that into someone, you're breaching all those barriers that naturally occur in a human, and now putting a potentially contaminated scope into that area, and all those defenses are gone. So you really have to worry about, how clean those instruments are, and make sure you're following the manufacturer's recommendations. That's why you're seeing this FDA alert go out today.
Right. So what should a patient who needs to use this type of diagnostic or even treatment procedure, what should they do to protect themselves?
Well, I think you can look at each hospital is going to really be reevaluating how they clean endoscopes, and I assume that most people will re-examine these, will change their practices if there are lapses, and be very meticulous. For the general public, they're going to just have to be alert and be careful if they are going to one of those hospitals that may have been affected there, to make sure that those infection control procedures have been implemented. And I'm sure a lot of hospitals will be putting out information to their patients about how they clean their duodenoscopes.
All right, Dr. Amesh Adlja, thank you so much for the great information. Do appreciate it.
Thanks for having me.